What I'm going to do is walk you step by step through a Medicare application as I enroll in Medicare. If you're new to Medicare and you're enrolling in both Medicare Part A and Part B, but not enrolling for Social Security income, this is exactly what you will be doing. Are you just getting started in researching Medicare and you need to know how to apply for Medicare, when you can apply for Medicare, or even how to delay your Medicare enrollment? This video will be a special treat as I discuss these subjects, then take you through the process as you watch me apply for my Medicare. You'll see firsthand the questions and doubts that I had as I went through the process of applying for Medicare. I know you're going to love this. Hi, I'm Matthew Clausen with MedigapSeminars.org. We are an independent insurance brokerage helping people with their Medicare and retirement needs in 49 states, from Hawaii to Virginia and Alaska down to the Florida Keys. We are a true independent insurance broker. That means we work with all the major insurance companies and offer all Medicare supplement plans. Most of all, we represent your best interest, not that of an insurance company, and our services are free to you, the consumer. Check out our 5-star ratings, then contact us. You'll be glad you did. So how do you sign up for Medicare, and when? As soon as you turn 64 years of age, you should start researching Medicare. The first step is to learn how to apply for Medicare and when you can sign up for Medicare. So let's start with the easy part first. There are two groups of people who will automatically be enrolled in Medicare. Everyone else must physically apply for Medicare. The first group are those under 65 and on Social Security disability income. Your Medicare enrollment will be automatic on the 25th month of receiving that income. You do not need to do anything, and you should expect a Medicare card in the mail either just before or as you start your Medicare. The second group includes those who are not disabled but decided to start Social Security income before their full retirement age, before age 65. If you have been receiving Social Security income for at least 4 months prior to the month you turn 65, you too will be automatically enrolled in Medicare Part A and Part B. In either case, you'll be provided with the option to opt out if you so choose. There will be an opt-out card in your welcome packet from Medicare. Everyone else must physically enroll in Medicare to receive benefits. What I'm going to cover first is when to enroll and then how to enroll. I also have created a clickable menu system in the video information box below, and you'll be able to display the menu so that if you're watching on TV and can see that menu system on the bottom, you can move forward or backwards. You can do it on a PC as well. So what is Medicare? Of course, we can't discuss how to sign up for Medicare without using some of Medicare's terminology. So let's start by briefly reviewing what you need to know about Medicare to answer the question, what is Medicare and when to apply? When you apply for Medicare, you'll receive a red, white, and blue card as proof of enrollment in Medicare Part A and or Medicare Part B. One of the most confusing features of Medicare is the terminology. Medicare is made up of parts, and those parts are referred to by a letter. There's a Medicare Part A, Medicare Part B, and Medicare Part D. Medicare Part A is inpatient coverage. It's the part of Medicare that helps to pay for inpatient care when you're in a hospital or other medical facility. Medicare Part B is your outpatient care. That's your insurance coverage for all of the outpatient and physician services. Medicare Part D is for prescription drugs, specifically the prescriptions you pick up at a pharmacy or mail order. There is also Medicare Part C, also known as Medicare Advantage plans. Medicare Advantage plans are a privatized replacement of Medicare Parts A and B. That's important. Medicare Part C replaces Part A and B, and Part C is more commonly known as Medicare Advantage plans. If you would like to learn more details about the parts of Medicare and what they cover, please see my video titled Medicare Explained. That video is linked above my left shoulder and in the show notes below. So in this video, we will focus solely on applying for Medicare Part A and Part B, also known as Original Medicare. Your prescription drug coverage is separate, and I have details on your Part D prescription drug coverage at my partdshopper.com website. I'm sure as you worked over the years, you've noticed a Medicare payroll tax deduction. Now that tax deduction paid for Medicare Part A inpatient care only. If you or your spouse have worked for at least 40 quarters or 10 years during your lifetime and paid that tax, you're eligible for Medicare Part A premium free. It will cost you nothing. Medicare Part B is your health insurance for outpatient and physician care. Any outpatient services, physician services, and durable equipment like a wheelchair or walker are all covered under Medicare Part B. Basically, if your health care is not covered under Part A, it should be covered under Part B. Keep in mind, Medicare's intent is to cover everything that is medically necessary, and Medicare relies on your doctor to determine that need. Medicare Part B has a monthly premium, so most people will pay the standard monthly premium, which can change every year. It doesn't always increase, but usually does. Higher income beneficiaries will pay an extra surcharge. Keep in mind, your Medicare Part B costs the U.S. government, or the taxpayer, more than $600 a month. The higher your income, the closer you get to paying that full amount. Now, I have an entire video and article on the Medicare surcharge. It's called the Income-Related Monthly Adjustment Amount, or IRMA, and it's linked in the video description block and, of course, above my left shoulder. When you're ready to enroll in Medicare, go to the Social Security website. Medicare is a subset of Social Security law. Keep in mind, you don't have to take your Social Security income to get Medicare. They're separate programs. So what I'm about to show you is how to enroll in Medicare alone without enrolling in Social Security. Here's what's important about your initial enrollment period and the fact that Medicare Part A is already paid for. If you're eligible for Medicare Part A premium free, there's no penalty for late enrollment in Part A. Technically, there's no late enrollment for Part A if it's already paid for, and I'll get more into that in a moment. Plus, you can enroll in Part A only, and if you qualify, delay your Part B indefinitely. Generally, we encourage people to delay enrolling in Part B until you're ready for Medicare to be your primary insurance and you're ready to cancel any other insurance like your group health care. You can enroll in just Part A inpatient care if you wish. Your Part A costs nothing, and you'll work with, or your Part A will work with your other health insurance to increase your insurance coverage. Medicare Part B, however, has a monthly cost to you, a premium, and you can be penalized if you don't enroll when you're supposed to. So unless you are disabled under 65, the earliest your Medicare can start is the first day of the month you turn 65. Medicare always and only starts on the first day of a month. The period of time that you need to enroll in Medicare is called your initial enrollment period. It's a 7-month window that includes your 65th birthday month. It's the 3 calendar months prior to your birthday month, and the 3 calendar months after your birthday month. 7 months in total. There is one exception. There's always one exception. If your birthday lands on the first day of a month, then your entire enrollment period moves forward by 1 month. Now, I have a free enrollment calculator. This is confusing. It's on my website that I will link here and above my left shoulder. You'll find the link from my website homepage under the Resources tab. But let's do a quick example. For example, if your birthday is April 20th, the first day that your Medicare can start is April 1st. You can apply for Medicare as of January 1st, 3 calendar months prior to the start of your Medicare. The last day that you can apply for Medicare during your initial enrollment period is July 31st, the last day of the 3rd month after your birthday month. In this example, the person applying for Medicare prior to April 1st will have a Medicare start date of April 1. If the application was submitted in April, Medicare will start on May 1. If the application is submitted in May, Medicare will start June 1. And so on. Referring to the one exception, if your birthday was April 1st, instead of the 20th. Then the entire process will move forward by 1 month. Your Medicare can start no earlier than March 1. Your initial enrollment period starts the prior December 1 and ends on June 30. If you miss your initial enrollment period and do not have creditable coverage, you must wait until the general enrollment period from January 1 through March 31 of each year to enroll. However, if you have creditable employer group health care, you can apply for Medicare whenever you wish. You create your own special enrollment. So please see my video titled Working Past Age 65, Avoid Medicare Penalties and Mistakes, also linked above and below. As you start this enrollment process, please keep in mind that it takes time for Medicare to get that red, white, and blue card out to you. In fact, it typically takes about 30 days after you apply to get your card in hand. If your Medicare starts before you receive a card, no worries. I'll show you in a moment how you can retrieve your Medicare number early from the Social Security website. Keep in mind, Medicare benefits exist whether you have the card or not. If you need medical care after your Medicare starts, but before you have a card, the procedure will all be rebilled once you have your Medicare number. But before we talk about who can delay enrolling in Medicare, I would like to ask you to please press the like button below if you're watching this on YouTube, and please let me know in the comments if you find this information helpful. And when you like, comment, or share this video, you're helping me by letting YouTube know that this video is worth watching. So thank you in advance. So can you delay enrolling in Medicare? Yes, if you or your spouse have creditable health insurance coverage. In general, creditable health insurance is usually employer-sponsored group health care as long as your employer has 20 or more employees and you or your spouse that has that coverage is actively working. Keep in mind, your employer-sponsored health plan can be creditable for Part B outpatient care, but not for your Part D prescription drug plan. Please see my video titled Medicare Part D Creditable Coverage Snafu for details. So it should be linked above, and if not, it's certainly going to be linked below in the show notes. I also have a creditable coverage cheat sheet available for you so you can see what is or is not creditable coverage. Penalties for not signing up for Medicare at age 65. If you fail to enroll in Medicare Part B during your initial enrollment period and you do not have creditable health insurance coverage, you can expect to pay a 10% penalty for every 12 months that you went without Part B. Now, this penalty is permanent and it has to be paid with every Part B premium payment for the rest of your life. The 12-month countdown starts the day your Medicare would have started if you enrolled when you were supposed to. So again, to ask the question, who can delay their Medicare Part B? Anyone who has creditable coverage through their own or their spouse's insurance policy can delay Medicare Part B enrollment indefinitely. So now that you know when, let's show you how to enroll in Medicare as you watch me enroll. Hi, I just wanted to take a moment to be sure you're aware of something that you may find helpful. If you're just researching Medicare and trying to figure out which plan is right for you, you may find my free Medicare Mini-Course helpful. This is a 4-part course of short videos to help you understand Medicare so that you can make an informed decision. Just head on over to MedigapSeminars.org or click the link above my left shoulder. And look for the talking head in the lower right of the screen. When you click on it and choose the free Medicare Mini-Course, you'll be glad you did. Oh, and if you like this video so far, please help me out by pressing the like button and feel free to leave a comment or a question. So let's get back to the video. What I'm going to do is walk you step by step through a Medicare application as I enroll in Medicare. If you're new to Medicare and enrolling in both Medicare Part B and Part A, but not enrolling in Social Security, this is exactly what you'll be doing. What I'm going to do is walk you step by step through a Medicare application as I enroll in Medicare. Now, if you're new to Medicare and you're enrolling in both Medicare Part A and Part B, but not enrolling in Social Security income, this is exactly what you'll be doing. Now, to enroll in Medicare, go to the SSA.gov website, Social Security's website. If you enroll from the Medicare website, it simply links to this site. So let's watch as I enroll. Now, you should already have a My Social Security account, and I suggest logging in using the new login.gov, and that will unify, or supposed to unify, both Social Security and Medicare access. And if you don't yet have the login.gov access, I strongly suggest you get it soon. I do. I have the login.gov set up, and we'll sign in using that link. Of course, they would text you a security code, and I haven't set up any additional authentication method yet, so that'll have to wait for another day. Now, I suggest reading the terms of service. I did actually find them interesting. And then after you've accepted this and moved to next, this is where I first got confused. There's no immediate Medicare link visible. I had to scroll down and looked around and found Start a Medicare Application, and from there's also a checklist available in PDF format so that you can get everything ready before the application. Now, I've saved those things. I have a copy linked in the show notes. It's good to go through because, as you'll see, the website's quick to kick you out when you're not actively moving forward. So this is where you start your Medicare application. And of course, there's a new terms of service to read and sign. And this was a bit confusing because it looked like an application for Social Security benefits. And after reading through it, I clicked the Start a New Application button. And you can see it's kind of confused here. I don't want Social Security, I just want Medicare. So this page was easy. It's just basic information. And then more basic information. And then I click Next, and I'm not sure what happened here. I don't know if I took too long on the form or what, but as you can see, I was kicked out due to inactivity, of course, even though I was completing the form. So I clicked Next, and this is where things got scary. You can see on the top of this page, it says, Apply for Social Security Benefits. I'm not applying for Social Security benefits, just Medicare. So this was confusing. So I decided to go to the top menu and click on Medicare and then sign up for Medicare. And it brought me back to the beginning, and I had to re-log in. So here I'm back to the application and the basic information all over again. And again, the top says Social Security. I wanted to say Medicare. It made me nervous, but I continued. Yes, you do have to be a citizen or legal resident to get your Medicare. This is finally where I wanted it to be. I get to see or confirm that I am applying for Medicare only, and this was a big relief for me. And that brings us to a next very important spot. If you cannot complete the application in one sitting, it explains that you must use a re-entry code, a re-entry number, to get back to your application. And I used the print option here to save this to my PC as a PDF form. That way I have the re-entry number saved without being just another piece of paper on my desk. I don't need any more paper on my desk. And it also has a section talking about requirements to sign documents and that they must be received by a specific date. And this led me to believe that I have to print something out or maybe even physically mail it. It's not the case, as you'll see in a moment, but it was confusing. So next it asks if I want to enroll in Medicare Part B, which I do. And if you've been able to read along, you may have noticed that the application says nothing about Medicare Part A. Medicare Part A is automatic. When you enroll online in Medicare Part B and you're eligible for Part A, they just give it to you. It'd be nice if they wrote a paragraph about that to reduce the potential confusion. And the questions about group health care are for coordination of benefits. The answers, so I answer everything with data as of the day of the application. So the health insurance information and the employment both have the ability to indicate really, what are my benefits today. And our employer health care rolls over every July, so July 1, so I just used the July 1 date. And for your health insurance, the start date again means the last time it rolled over. So I found this odd, the free speech section, I guess. It's a section for additional information without really specifying or indicating what type of information that they're looking for. So I indicated that my group insurance will not continue past my Medicare start date. So now comes the review. The form indicates at the bottom that you can't go back and fix mistakes once this form is submitted. So I double and triple checked for accuracy to make certain that it's exactly correct. And notice here that the signature, as I suspected, is electronic. The previous section that seemed to indicate it was to print out and sign something and physically mail it was just misleading or confusing. I didn't understand why that was in there. So that's it. The next step is to save the confirmation page with the confirmation number. You may want to explore some of the links from this page as well, by the way. Under the frequently asked questions link, you can find another link that shows you where to go to check the status of your application. It says wait a couple days to do that. And I believe it's worthwhile to save all of these pages as a PDF file, just print and save to your computer. Once your application is complete and submitted, you should get an email confirmation from do not reply at ssa.gov. Mine indicated the application was received in the Birmingham, Alabama office. It indicated a representative may call even after my regular hours, or I might receive a letter within 30 days if they need more information. I received a benefit verification letter within 3 days of submitting the application. Now that was very quick. That's one of the fastest turnarounds that I am familiar with. They usually take much longer than that. But now I have a Medicare number. You can also access your benefit verification letter and check on the status of your Medicare enrollment details on your My Social Security website. As soon as you log in on that front page, they have a section for that. Once you have your Medicare number, I strongly recommend you go ahead and enroll in a free mymedicare.gov account to help you manage your Medicare. In future videos, as a matter of fact, I'm going to show you how to use your mymedicare.gov account to manage your Medicare. But now it's your turn. I make these videos for you to help you make an informed decision. Please leave me a comment below and let me know what part of this video that you found most informative. And if you have a question that I didn't answer, ask it below and I will do my best to respond. I hope that you found this information helpful. So please like this video, subscribe to my channel, and give me a thumbs up if you found the information useful. Also, feel free to share this with others or on your social media so that other people will know what to do with their Medicare and how to enroll. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.